Hello, good afternoon, everybody. This is Labake Organization production on post-traumatic stress disorder. So what's post-traumatic stress disorder? This is an anxiety disorder that involves overactivation of fight and flight responses. Fight and flight responses are natural responses when we are exposed to traumatic events. But when we are constantly reminded of the trauma, and as a result, this interferes with our physical and mental well-being, and we are unable to perform activities of our daily living. It involves experiencing the trauma through flashbacks, nightmares, feeling constantly on the edge, and avoiding places that might remind one of the trauma. So now, who gets post-traumatic stress disorder? Anyone, young, old, male, females can get post-traumatic stress disorder. Veterans are at higher risk. Also, anyone that has experienced or witnessed a physical or sexual abuse, an accident, a disaster, or other serious events can get post-traumatic stress disorders. So, who are at risk? What are the risk factors for post-traumatic stress disorder? One is being exposed to traumatic experiences, especially during childhood, getting hurt or seeing people being killed, feeling horror, helplessness, or extreme fear, having little or no social support after the traumatic event might have happened, history of sexual abuse such as rape, assault, or sexual violence from partners. So, symptoms of post-traumatic stress disorder, we have behavioral symptoms such as agitation, irritability, hostility, self-destructive behavior, or social isolation. Psychological behavior, you have flashback, fear, severe anxiety, mistrust. Your mood, you have loss of interest or pleasure in activity, or guilt or loneliness. You have sleep insomnia, inability to sleep, or you have nightmares. If you're having nightmares, then you can sleep. Also common are emotional detachment or unwanted thoughts. So statistically, 1 out of 6, 1 to 6 people out of 100 people in US will have post-traumatic stress disorder at some point in their lifetime. 1 to 5 adults out of 100 in US in a given year will have post-traumatic stress disorder. In 2020, about 13 million Americans have post-traumatic stress disorder. You can imagine now, post-COVID, I'm sure the number must have gone up. Women are more likely to have post-traumatic stress disorder than men because of the type of trauma, such as sexual abuse and assault, than men. Veterans are more likely to have post-traumatic stress disorder. Now, so what? Treatment. Seek medical attention. The first thing, you have to seek medical attention. It requires medical diagnosis. It requires professional medical person to treat you. What are the treatment? We have different therapies for different people. Your symptoms may be different from mine, so my treatment may be different from yours. Different therapies, and they may need to use medication for you. Point in the case, all these ones, seek attention, get treatment. You need medical diagnosis, and take care. Bye-bye.